All right. Hello, everybody. Welcome again. Good afternoon. This beautiful, sunny Wednesday afternoon. Happy March. March is the Nutrition Awareness Month, as well as the Women's Awareness Month. So let's celebrate all the women as well as our nutrition. Welcome, everyone. We are back again. This is Community Engagement and Consultation Group. We have some amazing pop-ups for this month. So let's get started. Let's jump into it. Okay. As we've always done this, feel free to ask questions, put the questions in the chat. And for those who are able, who sent us their question through our crowdsourcing, thank you. We are here to answer your questions, and we have our wonderful Dr. Wilson, who will be our presenter for this pop-up. All right, before we get started, I'm gonna have to introduce Dr. Wilson. So Dr. Wilson is a research assistant professor at the University of South Carolina's Arnold School of Public Health in the Department of Health, Promotion, Education, and Behavior, and has worked in the field of public health in various capacities for more than 15 years. She has worked specifically on minority health research over the last 13 years. Her research and public health experience includes obesity, diabetes, heart disease, prevention, community engagement and organizing, nutrition, health policy, and program evaluation. She has also served as a health educator for Prisma Health for 10 years. And is certified through Emory University in partnership with the Centers for Disease Control and Prevention as a healthy lifestyle coach. Dr. Wilson, welcome, and thank you so much for being here today. And this is Food is Medicine Part 1. So I'll go ahead and share the slides. Dr. Wilson, just give me a second here. Okay, I'll share the slides. All right. Yeah, we said I'm going to the slideshow mode. From the beginning here. Oh, okay. So it's not letting me share the slide. From the beginning, slideshow. So what's interesting about technology, you prepare, then this happens. But anyway, let's go ahead. Yeah, let's go ahead. Let's go ahead and get started, Dr. Wilson. Can you see the slides?
I can. Thank you all. First, thank you all for having me. It's an honor to be able to be a part of the series with you all. Such a month that is dedicated and to greatness. Happy International Women's Day. And nutrition is something that's very near and dear to my heart. And so today I just wanted to talk with you all more so about healthy eating and active living for disease prevention. And we can go to the next slide. And so I like to begin with telling you all just a little bit about who I am and why I choose to do the type of work that I do.
Hold on, Dr. Wilson. I'm trying to advance the slides here.
Okay.
All right. So what is going on with the slides? Slides are not advancing. Oh no, let's see. Okay.
It advanced on my end from my view.
It did advance on your view. Mm-hmm. So are we on slide 2?
3. Now you are on 2, but if you click back to 3.
Okay, there you go.
It's there. And so I like to just give you all just a little bit of background information on who I am to kind of help inform my passion for why I do the type of work that I do. And so just growing up, one of my grandfathers and my grandmother, they basically farmed, and they are from Charleston, South Carolina, in a community called Salagree, which is near Folly Beach. And in that community, the Gullah Geechee culture is very rich. And along with that, it's just a lot of community members assisting each other with, my grandfather being a major player in that, and my grandmother, and just providing food to the community, sharing of food, celebrations involving food, stories being shared around food, just a lot of relationship building, a lot of community building around food. And fortunately, it was a lot of good food right out of his garden, right off of out of the ground. And so those are the types of experiences that I grew up around. But then I also grew up around with my paternal grandparents, a lot of disease. And so with that, I can just recall at a younger age, my paternal grandmother being diagnosed with diabetes. And so even as a middle schooler, I was a part of her care team. She lived alone, but we didn't live too far. We lived in the same community, Orangeburg, South Carolina. And with that, I just was able to see firsthand her battle with diabetes, and the choices that she made for food. And then along those lines, how her diabetes got progressively worse to the point where she had one leg amputated above the knee. And at that point, even as like a sixth grader, one of my sisters and I, we took turns staying with her at night, just to make sure that she was okay and didn't go into a diabetic coma. And so just having somebody there. And it got to the point where she became a double amputee. And so both of her legs were amputated above the knee. And then she also became legally blind in one eye because of her struggle with diabetes. And so growing up, I always wanted to become a medical doctor. And after witnessing and being a part of her battle and just serving in any capacity needed to kind of help her with all of the changes and life changes that she had to endure because of diabetes, I began to think a little bit differently about the preventative side, like, well, how can we not have these issues? And so going to college and everything, I still was on track for med school. And so my undergrad degree was in chemistry, but by the time I was in undergrad, before I finished, I decided that I was going to go more of a public health route, because population health, public health was more important to me. And I wanted to work on the preventative side of health. And so all those experiences culminated for me just becoming a researcher, and most of my research has been involved with minority health, and also chronic disease prevention, with a heavy focus on diabetes and heart disease. And so that's why I'm here. That's why I do what I do. And I'm passionate about the work that I do. And I know that it's invaluable, especially in our communities where chronic disease is so prevalent. We have to kind of look at what can we do from a nutrition standpoint, policy standpoint, environmental standpoint, system standpoint on how we can improve the health of our communities through working towards some changes at the individual level, but then also at larger levels as well. So let's talk about what we're gonna discuss here today. Okay, perfect. So I know we have quite a bit of an audience today, and as Dr. Anita said, Dr. Mwalui, please put them in the chat, because there will be a question and answer session at the end. We'll talk about some of the problems, we'll talk about some solutions, and we're also focused on what my instructions were and what you all were wanting more of. It's just maybe just some nutrition education that you can take advantage of personally, and we can certainly talk more about that, and we'll address that today. And we'll also do some goals. We'll talk about some goals that we can set for ourselves as we are going about this conversation today. And so we'll keep going here with our slides. So I wanted to talk a little bit about some of the facts associated with disease, and especially in minority communities. So in the US, African Americans, we have some of the highest rates of obesity. is primarily due to poor nutrition. When I say due to poor nutrition, that's also involving just not only just individual, our individual choices, but also policies and of some sort that may prevent us from accessing proper nutrition, or lack of policies that promote those types of facts to be true. Our environments and how our environments support or not us being able to access proper nutrition. So it's just not I'm not saying here like this is all of our own fault, because it's not. So there's a lot that goes into the why as far as the poor nutrition. So we're not just blaming ourselves for where we are, but it's a policy issue, it's a system issue, it's an environmental issue. But certainly what us as individuals alone can do is just work on improving our personal choices. And we also note through research, if you're impacted by overweight or obesity, that's associated with a number of chronic diseases, including diabetes, hypertension, cardiovascular disease, which is the #1 killer for everybody. But when it comes to African Americans, we are disproportionately affected and also have higher rates of death from heart disease than any other race. And so it also presents an increased risk for several types of cancer when you're impacted by overweight or obesity. And so for more than 95 years, heart disease has been the leading cause of death. And so that's a very long time when you look at all the advancements that have been made in other areas of health and where we could be. So it's been an issue for a long time. And so there are different solutions that are needed to then now address this. Diabetes was the 7th leading cause of death in the US in 2017. And the risk of diabetes is 77% higher for African Americans. And we also have this term where African American foodways is known as the intersection of food and culture, which is also through research shown to be a unique contributor to cardiovascular disease. So what areas of our culture are just, creating more opportunities for us to further have complications with heart disease. So we'll talk a lot about that. And when it comes to, what work has been done in the field, some of the research that I focus on is just for African Americans to help address diabetes and heart disease. So we have, one project entitled the New Soul Study, which is where we randomize participants to either a vegan diet or just like a low-fat kind of regular US style diet. And each week we meet with our participants in a cooking and teaching kitchen to provide nutrition education. In addition to that, is exploring different recipes, looking at the African heritage diet food pyramid and basing recipes and meals off of that instead of the standard, kind of My Plate guidelines that you see in the standard food pyramid that you normally see. And so with that, the African heritage diet food pyramid, it really caters more to our culture. You'll see more rich and richer foods like more leafy green vegetables and more foods that are of the African diaspora. And so we also provide opportunities for hands-on experience with cooking and trying new recipes. In every class, there is a demonstration, a cooking demonstration, and opportunities where participants can taste the foods as well. So exploring ways to eat healthier, but then also preserving the culture and realizing that there are some staples that we just are gonna have. But even with that, learning more about what those staples are and how we can also enhance them nutritionally without compromising the flavors that we like and the taste that we're trying to achieve. So that's very important when it comes to nutrition and improving the health of our communities. We also have the dietary guidelines, 3 dietary pattern study that we're working on in partnership with the National Institutes of Health. And what that is that we are exploring the dietary guidelines, the US dietary guidelines as they are written. And so we conducted a pilot study where we presented a curriculum of how the dietary guidelines are just spelled out and what recipes and diets they recommend, Mediterranean, vegetarian, and healthy US, and delivered that curriculum to an African-American group, all African-American group, as they stated. And the goal was to, at the end of that study, collect responses. We did focus groups and interviews with our participants and collected feedback from them on how they perceive those dietary guidelines and receive these recipes and the curriculum from a cultural lens, and what factors were missing and or could be enhanced to more so appeal to African Americans. And so one thing that we found through that study and that pilot is that when it comes to meeting dairy recommendations, there's a heavy push for consuming cheeses and milk, like cow's milk, in order to meet dairy recommendations. And from an African American standpoint, a lot of us have dairy intolerances. And in the research, we have a higher percentage of that than any other race. And so it becomes very hard to even meet the recommendations from the dairy food group because of lactose intolerance or dairy sensitivities. And so what our participants suggested is that they be given more information on more plant-based foods where they can receive those vitamins and nutrients that are necessary that are received, like vitamin D, from the dairy food group without consuming dairy. Another key area where feedback was requested from our participants is the incorporation of more culturally familiar foods and seasonings. So one thing was like, we looked at all these recipes and, there's not enough garlic powder. There's not enough thyme. There's not enough smoked paprika. We need those things. There's not a lot of recipes where they're calling for like vinegars. And so, so that was important. And so the reason why we collected this feedback is so that then we could go back and modify the dietary guidelines, curriculum, and recipes to fit the palate, and also to basically consider African American culture and make adjustments as needed. So mostly all the recipes were adjusted based on preference for our participants. And the dietary guidelines, just to back up a little bit, the dietary guidelines, they are developed and released. They're developed using evidence-based information that contribute to helping all Americans meet nutrient needs at every stage of life. So they're really the backbone and the framework for the SNAP program and recommendations that come from, that are provided to participants on healthy eating. The WIC program for women, infant, and children, and then also the school meals program. So all of those programs are informed by the U.S. dietary guidelines, which is the goal is to help people eat in a way where it meets all of their nutrient needs in order to help prevent disease. And so our research is unique because our results will help to contribute to the next phase of the dietary guidelines. And so when it comes to research, it's important because whenever you see the term, this program is based on evidence-based information, just know that research had to happen. Medications that are released for different ailments, they all have to undergo research. Now, one of the problems is, and why we, with our research, have focused on African-American populations is because we are underrepresented in a lot of research that's being done in the field. So, for example, if there's a medication for, let's see if it's metformin. Let's say metformin is a medication, and you look back at the trials that were conducted, and you look at the population of the demographics of the people that were in these trials for these medications, more often than not, you will see a very small percentage of participants being African American. So what does that tell you? It means even when it comes to treatments that are recommended and that are proven evidence-based and that are proven to have, you know, a certain success rate when it comes to addressing the issue that the medication was developed to remedy, you have to understand who were the participants in these trials. And so we all know that we are all unique, and we come from different parts of the world. And so it's important that we involve more minorities in research, because whatever evidence comes from that is reflective also on the people who were studied. And so we realize that that's something that we need to work on. And that is why our research has been geared towards African Americans. If African Americans are having more disparities and issues related to chronic disease and are suffering disproportionately, then we need more studying of what can help African Americans. And so that is what we're doing through our studies. You know, we also realize, so we're excited about it. We're excited to be able to contribute to evidence and results that can help inform future dietary guidelines, because these are the guidelines that are just for everybody. And so we need to make sure that we are reflected in that, that we are included, and that we have evidence-based strategies that work for Blacks in order to help, you know, resolve some of these disparities. And so even adding to that, why is nutrition and physical activity research important? You know, one of the things that I also studied was just looking at medical school curriculum. Of course, I wanted to be a part of that at one point. So, you know, what are medical professionals being taught? You know, primary care physicians, more particularly. Well, what I found is, and what through research they've also revealed, is that they're not adequately trained to provide any type of nutrition counseling for chronic disease prevention. So yes, you do receive patient education materials upon checkout when you have certain visits to the doctor to address certain health concerns. But on the back end of that, just understand that primary care physicians, they do not get paid. They can't be reimbursed for time spent doing any type of nutrition counseling. And at the same time, most of the medical school curriculum, they look at nutrition and health maybe as an elective. Some now are required, but the amount of hours that you spend, you're talking about maybe over 180, close over maybe 200 or so credit hours, or with medical school curriculum, and maybe only 3 of those being required for nutrition and health. And so there's a big push now for more inclusivity of nutrition and the overall impact on health, because research has also said that nutrition is a primary indicator of whether or not you will have, you know, develop some sort of chronic disease. So the evidence is there, like it's important, but most medical school curriculum is not reflective of that, because it was not necessarily designed for that. Back in, you know, in years past, it was for treatment only, you know, remedying the sick, you know, trying to help them get from point A to point B. And so there's a large push now, even within hospital systems, to focus on population health, and to just not treat people for illness and disease, but to look at the whole person and seeing how they can also help prevent more chronic disease, because it definitely is putting a dent in our overall budget. You know, healthcare is close to about 20% of the nation's budget we spend on healthcare. And when you talk about heart disease, like, it's very expensive, not only for the individual, but for the system as a whole. Like that, when we have to utilize that much of our budget for sick people, that means other areas can suffer. You know, we're talking about our defense. We're talking about programming that we're able to offer in communities. We're talking about environmental issues and structures. So, I mean, it all goes together. And so there needs to be more of an even balance of everything when it comes down to an economic standpoint for how all this impacts us. So we need more African Americans involved in research. And a way to do that is to have more research that is geared towards those that are not represented. And so, you know, in order for us to get the proper treatments and recommendations that we can share, because see, medical professionals, they're also relying on the researchers and the research to kind of help inform their work too. And so from a policy standpoint as well, you know, right now, if you go to the doctor, they know they are not adequately trained to provide nutrition counseling. They can't get paid to do it. And they have so many other things that they are, just like in a school system. If you're a teacher, you have curriculum and you have standards that you have to meet, like doctors have the same thing. You know, and then finding time at the end of the day to do follow-ups and paperwork and all these things they're expected to do. So they can only do but so much. At the same time, they are charged with preserving the health of the individuals and trying to keep people healthy. So they'll say, maybe, you know, like, I'll recommend that you see a nutritionist if you have more concerns about nutrition, or connect with a registered dietitian. Well, first of all, registered dietitians are rare as well. And most of them are also in private practice. And the issue with that is it's not readily accessible, because insurance does not pay for you to go see a nutritionist or a registered dietitian. So that means you're having to pay out of pocket for these things. And even, you know, 15 years ago, I know a registered dietitian, her hourly rate was $100 an hour. And so that was 15 years ago. Imagine what those rates can look like right now. So it becomes a financial burden for the person who also needs the assistance. And so we have a responsibility to move the needle forward in a lot of those areas and work towards that. So, you know, what can we do in the meantime with our personal choices? You know, some I've listed here. We can choose and commit ourselves to being more active. We know that being more physically active is going to strengthen our heart, which is connected to cardiovascular disease, and is why, you know, with heart issues, that's like killing us the most. So, you know, one thing that I like to also communicate with our participants or anybody that I'm counseling or working with is making sure that messages are framed in a way where people can understand and receive it. And so literature will tell you to be active for 120 to 150 minutes in a week. Well, if somebody came up to me and said, hey, you know, I have $120, $150 that I'm going to give you, I feel like that's a lot of money. 3 years ago, I would have felt rich. But still, you know, the value of the dollar has slightly declined. But for me, that's a large number. You know, it's like, oh, I can do a lot with that. And so we come from the same frame of mind when we look at that from a physical activity standpoint. It's like, oh, that's a lot, you know, like, I don't know if I can fit that in. It just sounds like this big number that I'm going to work to achieve, and it's going to be discouraging. And so what I do ask folks to do is to kind of calculate how many minutes are in a week, right? And so when they do that, they find out that it's over 10,000 minutes in a week. And so then I say, well, of those 10,000, over 10,000 that you have, I think it's 10,080 if I'm not mistaken, then I only need you to do of that 120 to 150. And do you feel like you can commit to doing that? That's just such a small percentage of that 10,080 minutes that you have available to you. And folks feel more empowered and feel like, well, you know, I can do that. And I even take it as far as, God asks us to give 10% in the charge of our resources. You know, we are, the state takes out taxes at other percentages, and we're given in all these other areas. And it's like, well, that's less than 10%. I think you can be able to do that. And so folks are then more empowered and feel like that is something that they can accomplish. We can also, from a personal standpoint, we can do our best to eat more well-balanced meals and snacks. A lot of times you hear eat well balanced meals. It's like, okay, yeah, but it's like, what about the snack part of that? Y'all forgot y'all eat snacks 2-3 times a day. Like, you need to apply the same framework to that as well. So it just doesn't apply to meals, but even with your snacking, make sure this well balanced. When you attach a protein source to your snack, you're gonna feel fuller longer. So what does that look like? You can have some yogurt, you can have some nuts, along with that fruit. So one of the things is limiting processed foods. You know, my dad always told us growing up, if our health is the last thing we want to lose, we want it to be the first thing that we try to take care of. So the processed foods, of course, you know, we know that they are very limited in the nutrients that they offer. And you can look at that by a food label. So food label reading is one of the things that, you know, is important for folks to make sure that they pay close attention to and know how to do, because you need to understand what food labels mean in order to help you make better choices. You need to understand what that daily value percentage means. So when you see a food item and it has, you know, so many milligrams of sodium, you need to understand contextually, what does that mean for you in that day and how that contributes to the nutrients that you need to gain and the things that you need to limit. So if you see a snack and it says for the content and it's 50% of the daily value or DV, you need to understand that you are getting 50% of the sodium that is recommended that you have in one bag of chips. And it's just like, well, man, you know, I have 3 other meals I need to eat for today. So I'm getting 50% of the sodium that is recommended that I have in one bag of chips. That's not a good thing. And you can look at other areas as well. Look at total fat grams of different items. So anything processed, it's going to have a food label on it to kind of tell you and help you be informed on what it is that you're consuming and how that's going to contribute to what you're doing in the nutritional choices that you're making. So when you're limiting those processed foods, you know that the foods that you are eating have more nutritional value. So anything from the land, anything off a tree, out the ground, off a vine, you know, it is not processed. And so those are the types of foods that you want to eat more of, more whole plant foods. Lowering the salt and pumping up the herbs and spices. So when it comes to herbs and spices, you know, playing around with them, exploring with them, to kind of get some sort of balance that you like and that you prefer. So, you know, you're going to need to get into the kitchen to do that. You know, you cannot, and this is one thing that I tell my participants as we are learning about salt and working to kind of lower sodium in the diet, is that you cannot use herbs and spices sparingly in a way where you're kind of used to sprinkling salt. It's not going to help you. It's not going to give you the flavor that you want. I guarantee, like when I buy garlic powder, I buy it in the bulk size because I already know I'm using a lot of it. And the more garlic powder I use, the less salt I'm going to have to use. And so you want to pump up those flavors as much as you want. So folks feel like, oh, because they are told to limit salt, that they need to apply that to other herbs and spices and seasonings that don't have sodium, because that's kind of what the language is that they're used to hearing. But it's the exact opposite. Prior to me buying the bulk herbs and spices and or growing them myself, you know, I would just kind of go through a bottle of garlic powder like every week. That was something I was buying in the grocery store like every week. And so getting out of that mindset, when it comes to the herbs and spices, use as much of it as you need and like to get the flavor that you want. And even growing them is going to save you some money. You know, you can grow garlic, you can grow thyme, you can grow rosemary, you can buy a pack of seeds for like $2. It's going to have like 100 seeds in them, and you only need like one for one plant. So just imagine if 100 seeds are in, you know, or in a bag. It's like you're paying like a penny for a seed, you know what I'm saying? And so it's like 1 penny is gonna warrant you like a whole bush of rosemary that you can grow. I see a question in the chat, and I can answer that as we go along. So y'all can keep them coming if you like. Canned foods are known for, I'm sorry, Dr. Wally, can you please read that? It kind of disappeared on my.
Yes. Yeah, there are actually quite a few questions up
Okay.
here. So let's start from the first one.
Okay, sure.
How do you address dietary guidelines where healthy foods are not accessible? Because you talked about having all these plant-based and staying away from processed foods.
Mhm.
But if you have a family that is based in a food desert
Right.
region, and the only place they can go shopping is, let's say, the Dollar Tree or
General, yeah.
Dollar Value, how do you, how would you address the dietary guidelines when that's the only way they can access their food intake?
Yeah, and that makes it tough. It really does. And so from an access point of view, that is definitely why, from an economic standpoint, city officials, your mayor, your city council, is why they need to be pushed to support local grocery stores and support development that includes being able to bring in more of what the community needs. We don't need any more liquor stores. We have gas stations, and we need more grocery stores. So they need to know that that's what the community wants and needs. They work for us. So, but that's a process, and that takes time. So what recommendations do I have? Because it's real. We worked in communities where that was a real issue. With one of our grants where we were focused on addressing obesity and improving the food system. And we were working in a small rural community where there was one bus in that community that came and arrived maybe like 7 a.m. And it did not come back to bring residents back to their home, because they all, a lot of them would use the bus to get to work. And also to even, kind of get kids back and forth to school. And they didn't come back until like 7 or so at night. So there was no grocery store in that town. There was a liquor store. There was not even a gas station. And there was a Dollar General. That's it. And so what do we tell folks? Well, there are times where you're just going to have, in situations like that, where you're just going to have to make do with what you have. And so making the best choice from what it is that's available to you. So when it comes to like seasoning foods and things like that, you can still use the same recommendations as far as seasoning your food with lower sodium. There's a heavy canned food items available in communities where you're in a food desert. So yes, buy the cans, but even be more intentional about what types of canned foods you're buying. So instead of buying the ravioli, maybe just buy the pasta itself, and then getting a lower sodium sauce where you can control a little bit better how much sodium is even getting into your diet. And it's the same thing. You still have your noodles, you still have your sauce, but there's still a clear, better choice that will, provide you with better nutrition, lower sodium. So it's just the difference of getting something that's not as convenient from convenience, but then putting together something that makes a little bit healthier meal in that. And even if you're buying canned vegetables, yes, they are very high in sodium, but you can also rinse them. So rinsing all that off and then kind of starting over from there and seasoning it yourself, that also cuts the sodium down. And so what we tell folks is rinse it until you don't see any more bubbles, or cloudiness. So it's like, well, how long do I rinse it? I don't know. Rinse it till it's clear. That's the best advice that we've given our participants to understand and know, like, that's how you're doing a good job of that. Because even like beans, I like beans in my diet. And they provide a lot of heart health benefits and a lot of fiber. It's like fiber is the thing in your diet that you want to get the most of, because fiber is like that thing that's going to tackle all those other bad things and push them right on out of there. And so you can better absorb the things that you need to absorb, pulling out all that vitamin A, C, and all that stuff. So the fiber is that type of like cleanup type thing in your body where you need more of it. And so beans provide you with a lot of that. So I also don't want to spend 2 hours cooking beans, right? So even me, like when I want to have more convenience, I'll buy the black beans in a can. But I also know that because they're sitting in that juice and everything to preserve them, like that's full of salt. So I'm just going to rinse it right on off until it's clear and no more bubbles and things. And I'm going to eat it and I'm going to be just fine, because I'm not also going to add salt to it. I'm just going to add, like, I'm going to add some cumin. I'm going to microwave that with some of that and some cilantro or something, and I'm going to be all good to go. So the other thing is, in that same community, we also worked in partnership with the library to start a community garden. So where folks got to volunteer, participate, also get fresh produce that was seasonal, because of course you can't grow everything all year round. But you know, when it comes to the fall, you can grow all the greens that you want to grow. There are a lot of herbs that you can grow year round that'll last. And then in the spring is when you also try to grow an abundance of things that then you can kind of preserve and save for the fall and winter. And so the community garden, the library was set like right in the center of the community. And it's just like neighborhoods were all around in these pockets around the library. And so that sparked folks' interest in then starting to grow things themselves. And we had a master gardener there who also assisted folks in knowing and learning more about the food that they were growing, and being able to also take some of that food from the library and then do some cooking demonstrations to show people how to prepare these types of foods as well. So not that that's going to be the end all solve the problem, but it's just a solution that can contribute to the improvement of the health of the people and improve access. So now they don't have to take the bus and figure out how they're going to get back home, or stay out all day and figure other things out to come back home at 7 o'clock just because they need some carrots when that's grown at the community garden, and they can just be an active participant in that and get some carrots from that initiative. The other thing too is also working with local farmers in the communities. A lot of these rural communities have a lot of farm workers and a lot of farm land that they are sometimes growing commodity crops, but sometimes also growing, also growing other things as well to kind of sell. So even if it's just strawberries, if that's what they're kind of known for, then that's working with your local farmer, going to their fruit stands. And a lot of times it's cheaper to buy directly from the farmer because you're cutting out all these middle people, and you're getting the freshest of the fresh. When you go to a grocery store, just realize that those apples that you see that doesn't say grown locally or in the region that you live in, that they're coming from over 1,000 miles away. And it's going to take about a month for it to do that. So it's not like you're getting an apple fresh off the vine usually. And which is why when you're consuming frozen foods, those are great. Like if it's not grown in season where you're living, in your region, I opt for frozen, because we know that when it's frozen at its peak ripeness. And so it's preserving the nutrient level a lot better than an apple or a strawberry that's coming from over 1,000 miles away. Sometimes it's like the nutritional value, the longer that it's off that plant, the more the nutritional value is decreasing over time. So when it comes to making choices about food, when you have the ability to make that choice, that's also something I recommend folks do. It's like, look at the nutritional value of it as well as the product itself. Because if it's wintertime, ain't no strawberries being grown in South Carolina. So I have to understand that the ones that I'm getting in the store, they're coming from California. So the nutritional value of them as compared to something that I can buy in the frozen section for strawberries is going to be greater with that frozen section in that season, because strawberries are not in season in the wintertime in South Carolina. So you can go that deep with it when you're making your choices, and it's just all about being informed. And when you think about it, it's like, I never really thought about that. That makes a lot of sense, because, that's not something that they're going to like promote. They're not going to advertise that in the store. They're going to advertise it when it's locally grown, but if it's not, but you can easily read it on the package. So it's just like, I know California's cross country, and that takes a long time. And with all like the shipping and processing delays and transportation delays, that we've been experiencing, it's just like, yeah, it used to take about a couple of weeks. Now it's taking longer. And then think about it as it comes in. And these are all things that are components of the food system and the cycle of it. So it's grown. Someone is going to harvest it. Someone's going to package and prepare it. Someone's going to distribute it and all those things. So when it gets to that cycle, that point in the cycle where it's being received by a store, just know it's not going right out onto the floor for you to get it either. Like it has to be inventory, it's sitting in a freezer back there. My first job was in a grocery store. It's sitting in the back for a while too, before it even gets out onto the floor. They have to inventory it. They have to make sure it's labeled properly, that it's going to scan in properly, all those things. Then they put it out for you. So it could even be in the back of the store for quite a bit of time before it even makes it out to you. But then there's lots of preservatives and additives, of course, to kind of slow the delay of the spoiling of the food as well. Yeah. So you have to kind of think about all those factors. And I know that's a lot for that one question, but that is just how multifaceted these responses should be to these, what may seem simple questions. There are lots of different avenues of ways that you can explore that. The other thing now that has become more popular, thankful to the pandemic, is the fact that now online shopping has also transitioned over heavily into the grocery store section. So when you talk about Amazon Prime, you can buy groceries off of Amazon. You can, connect to Instacart. There could be a grocery store that might be farther away that's not in your community, but they will deliver it to you. So getting connected, you have HelloFresh, you have all these companies now that offer like groceries and fresh fruits and vegetables and produce that you can access. Some of them doesn't even cost anything, but some of them do. But when you look at it, the cost, when it comes down to whether you want to, it's all about priorities too. So a lot of times when we're thinking about healthy choices, we have to make that a priority, because I'm gonna tell you right now, I have Disney Plus, I have Hulu, I have Amazon Prime that I pay for, I also have Netflix. Like the list can be a little endless. Like I have to keep control over that. So why not pay for an Instacart membership too, right? I pay for everything else membership wise. So because health is a priority, getting fresh food is a priority, then I can also extend that into how I shop for groceries. And so for me, it's not that I live in a food desert, but it's also kind of the convenience for me in it. I work, I'm a mom, all these things. And so sometimes I don't feel like going into the grocery store because I'm limited on time and I don't want to take the kids, and that's going to extend the time in the grocery store. And then it's also more budget friendly too, because, I like to shop at Aldi and Lidl, and every week they have these different weekly finds, and I'm on that aisle or 2 aisles and I'm looking at everything. And so that's also going to increase my spending. And so as a way to kind of control my budget, I can shop online. I don't have to go in there and look at all those special finds that they have that I'm going to be intrigued about. That's in a nutshell, a couple of different solutions when you are living in an area where food access is a challenge. Number one, you can, and I'm working backwards, you can get a membership. You can do Instacart, or there's multiple companies that offer assistance with like buying groceries. That's just the one that I use. You have things like HelloFresh. You can work with your local farmer. And even if there's not a local farmer, there are sometimes local farmers markets that are not far away as well. So it could be like taking a Saturday and going and riding with a friend, and y'all car share, and y'all catch an Uber if transportation is an issue, or catch a bus, or just drive yourself, and go a little bit of distance outside of your community and get enough produce for the week, and make that sort of weekly field trip that you all can take and explore new food items and get the fresh produce that you need. And so with that comes a lot of planning too, food planning, meal prep. It's something that I kind of do every week. And once you start doing it, it becomes a habit. Like I already know from the top of my head, if I had to make a grocery store run, I already know the staples that I need without a list, because I know that I'm gonna need some mushrooms, onions, and peppers, because I'm gonna use that across multiple meals. I can use it if I decide to make spaghetti. I can use it if I want to make enchiladas. I can use it if I want to make baked chicken. I can use it if I want some grits and sausage, and I'm gonna have those on the side. So when you start making things a priority, it becomes easier. Not to say it's not going to be a challenge at first. I'm not going to sit here and lie to you. It is going to take an investment of your time, but you can make that investment up front, or you're going to have to make that investment on the back end. And so when it comes from a preventative standpoint, you want to be able to make sure you make that investment on the front end, because you're going to pay for it in some way. You might be paying for it in the medications. Metformin is expensive. Even with insurance, it's expensive. High blood pressure medication can be expensive too, because then they're going to start pairing you with like these calcium pills and all these other things that you need to take along with that. So it's like, can you make the investment up front, get one of these memberships, get Instacart, tip the driver or whoever it is a little bit, or do you want to pay for that on the back end as your health starts failing? So you have to kind of shift the mind and shift the thinking to kind of help make these choices a little bit easier. And I know, like, I like to talk, y'all, so I'm gonna let you go ahead and tell me what other questions are in the chat so we can confirm.
A lot of questions, but and that's why we were very intentional to have a part 1 and a part 2, because questions that are questions concerning nutrition. There's so many different questions, right?
Right.
Now, what's interesting about planning ahead, I think that's a skill that people have to actually, that we have as educators, we have to push for, especially where we don't have time. There's a lot of competing priorities with our time, being mothers, working full-time, being caregivers. There's so many different things, right? So this one question, you might have touched on it, but there's a question in the chat. As far as nutrition preservation is concerned, do you think cooking and freezing is a good thing? Because sometimes we cook all this food, and that's that's just more like speaking to the choir. I do that a lot because I don't have time to cook, right? So I'll get a weekend and I'll spend at least 5 hours in the kitchen prepping all this food that I will eat later, maybe 2 weeks later, 3 weeks later. Now, this question is asking that, do you think cooking now and eating 3 weeks later after, taking it out of the freezer is a great thing?
Yeah, most definitely. I want you to understand, like, that's a lot of what these places where you think you're going out to eat, that's what they're doing. Except, except, it's going to be a lot of the things that you don't need. Like, it's going to be packed with sodium. It's going to be this and that and the third. And you don't know you don't know how much sodium's in it. You don't know how much fat is in it. You don't know. So when you cook it yourself, and can control your hand on what it is that you're adding. You can add more fruits, and you can add more vegetables. You can add more herbs and more spices. You can add less salt, and you can freeze it and pull it out and reheat it. That's very safe. That is recommended. Because when you go to certain restaurants, just know that's why it's so easy for them to have these items in popular grocery stores in the freezer section, because that's all they're doing in the restaurant anyway. So it's just like,
that is true. That is
go back in that kitchen and you're gonna see them cutting open some bags and pulling it out the freezer and putting it in a pot and heating it up, and you can, like,
I know,
it's just so immaculate, and it's just like, girl, you could have did that at home, like.
That's right. Yeah. So we have one more question, because I know we are running out of time. We only have 6 minutes left, So what is the correlation between environmental health and nutrition?
The food comes out the ground.
And all those things we have to
food.
do. Right? Yeah.
But yeah, you need an environment that supports you to get the types of foods that you want and that you need. So you need an environment where pollution and waste is controlled in a way where it's not being released into the waters where your fish are living and where you're fishing and getting food from the ocean, because all those toxins are now going to be harbored by the food that you're eating, which can contribute to poor health, and can impact the quality of the food that you're receiving. Same thing with any type of waste that's being released on the land, and you have a farm that's growing the corn and the greens and the strawberries that you're eating, so that's why the EPA is important. The Environmental Protection Agency is important. That's why they need funding to kind of help facilitate that process for us, because you wouldn't know it. But that's where there's certain levels of pollution that needs to be regulated, because your food comes from the environment. And if your environment is full of pollution and toxins, just know that it will transfer over to the food that you're receiving from that community. So that is the correlation. And sometimes we don't think about all those things, but it's happening whether we realize it or not. And so you want to make sure that from an environmental standpoint, like your environment is one that enhances your access to food. And so that's why it's good to kind of be involved in the local political climate, because that's where you can have and make the most impact when it comes to change at your local level. And you want to make sure that your environment is just even, if transportation is an issue, you want to make sure your community environment supports you being able to safely get to grocery stores if you have to walk or if you have to bike. So that's why it's important to be a part of like local coalitions that address, bike safety and encouraging folks and raising awareness about being aware of folks walking and pedestrians and having sidewalks, so that it's also making it more convenient for you if transportation is an issue to get back and forth to the places in your community. So I hope that gives just enough of explanation to help answer that question for you.
Yeah, it does, and it does, and I think that's one of the problems that we see these days. As a gardener, I'm a gardener myself.
Mm-hmm.
We have a tendency of going out and getting all this manure, right?
Mm-hmm.
So we can enrich our soils,
Mm-hmm.
but not knowing, not knowing what kind of food that did that animal eat in order for us to get the manure, put it in our own soils.
Right. Exactly.
So yeah,
so you want to look at like grass-fed cows. If you're using cow manure to, you want to look at animals that are feeding on grass, because then it's richer in those nutrients from the grass. And then even like composting and things. So within the food system, you also want to make sure like you're recycling. So even when it comes to like food scraps that are like produce scraps, like you can use those when you are cutting up onions and things, and you have, the outer pieces that you don't want to use, you can use that. You can use any type of vegetable scraps, and you can put those you can put them in a pot of boiling water and make your own vegetable stock. You can put it out in the yard in a place where you can kind of keep it covered under leaves or hay or whatever. You don't have to buy anything fancy for that to compost, where it's enriching your soil, so that when I start growing my plants, and I'm about to start my garden for the spring, I can pull from that soil and get those nutrients and put them back into what I'm growing and making it richer. Instead of buying all this fertilizer from the store, I can do it myself. So even that, is just a way to kind of think about how you can even enhance your skills at home to support a healthier environment. These are just some free programs. That's more about our study. You can go ahead and skip that slide.
No, let me ask you a question, Dr. Wilson. Now, the diabetes prevention program, is this a program open to only residents in South Carolina, the county?
It is.
Okay.
It's in Columbia, South Carolina.
All right.
But there's also a website, All of Us. You can just Google that, where it encourages minorities to become more involved in research, and that's nationwide. So All of Us. and anybody can participate and see what's available nationwide for research that you can get involved in. The other thing I just want to briefly say is when it comes to making goals for improving your lifestyle, when it comes to nutrition, physical activity, stress management, you know, when you set goals, everybody wants to set, especially at the beginning of the year, New Year's resolutions. There's nothing wrong with that. You can start over at any point. You can decide any day, any time that you're going to do better, and don't feel like, you know, like you should be, you know, bashed or feel like you are a disappointment because you want to get on the bandwagon. Get on the bandwagon. Who cares? But you want to make sure that you're setting goals that are smart. They are specific, they're measurable, achievable, realistic, and time bound. So I'm gonna give you an example. A smart goal is not, I'm gonna start exercising and I'm gonna start eating healthy. That's not a smart goal. A smart goal for exercising is, I've looked at my calendar. I've identified that I have time on Tuesdays and Thursdays in the mornings between 6 a.m. and 7 a.m. And I am going to start next month exercising twice a week for an hour on 6 a.m. to 7 a.m. on every Tuesday and Thursday, because I know that my meetings don't start till 10. So I have time to exercise, shower, and get ready and be to work on time. That is a smart goal. That is how you're going to keep yourself accountable, because it's specific. You can measure it. You feel like that's something that you can achieve. It's realistic because you've already looked at your flow for the week and where it can fit in. And it's time bound. I didn't say I'm gonna just do it. I said specifically, I'm gonna start next month on this particular Tuesday. And then every Tuesday and Thursday after that, that's how I'm gonna meet my goal with achieving my physical activity. And so it kind of cuts out reasons for how you can excuse yourself from doing that. But just know that we all fall short, and that's okay. But you can easily, you've already made it easier for yourself to keep it a priority. So you might miss a day here and there. That's all right. Just get back on it. Or you can figure out how can you readjust. If Thursdays are now becoming a problem, maybe Fridays are going to be better. You know, maybe Saturdays while your kids are playing soccer, you can walk the field and accomplish two things in one. Maybe you have a favorite show that you like to watch every week, and it's an hour long. I know I do. Like right now, I'm watching Your Honor, and a new episode is coming out on Friday. Instead of me laying in the bed to watch it, maybe I can get on my stationary bike at home. And if I don't have a stationary bike, then maybe I can just do something to be active. I can just, you know, do some chair exercises or something. We use YouTube and social media for everything else. We can get on TikTok and you can look up 1-minute exercises to do at your desk. So it's just about changing your mindset, making things a priority, and just utilizing the resources that are available to you to help support you in those decisions. So I am done. I know we're like 2 minutes over time.
I know, you know, but it's a great conversation. You know, I'll stop sharing the screen.
Okay.
You know, this is amazing, Dr. Wilson. This is amazing. And I think, you know, we can never stop planning. That's it. That's for sure. We can never stop planning.
Mhm.
We need to hear this all the time to be reminded. There's a lot of challenges that we face as a community, as a society, you know, with all these barriers that we're faced with. And I'm so glad that you touched on a whole lot of barriers. Now, probably the next webinar sometime, you know, we'll have to talk about how the medication ties into the food that we eat, you know. So thank you so much, Dr. Wilson. Thank you very much. And you have a wonderful day. And for all our listeners who are on live stream, thank you. And if you have any questions, please don't hesitate. You can also go on our website and, you know, shoot us a comment, a message, an email, whichever you want, whichever you like, whatever works for you, and we'll get to you. And those who want to connect with Dr. Wilson, don't hesitate, do the same thing. Thank you. Have a wonderful day. Thank you, Dr. Wilson.
Thank you all. Thank you all.
Thank you.